A lot of precautions in here, a lot of times when you would not want to use this drug. Am I telling you you should never have this drug used on your dog? No. What I am telling you is maybe you need to educate yourself and make sure that your veterinarian is aware of all this. Every prescription medication comes with an insert that details potential risks and side effects. The problem is, most pet lovers never see that insert or are even informed of any potential risks before use. Whether you ultimately decide to use these medications, alternatives, or a combination of the two is your choice to make. The goal of this video is not to spread fear, but to educate and empower pet parents so you can ask informed questions and make the best decisions for your own pet. Hello everyone, I'm Dr. Judy Morgan, your pet's advocate. Today I want to talk about a new drug that is being used. I think it has conditional approval right now. We'll get to that as we move through. And you know me, hopefully, you know that I in practice, never used new drugs until they had been on the market for at least 5 years so that I could see what kind of adverse reactions animals were going to have to the drugs. So anytime something new comes out, remember that it's been tested in small numbers on laboratory animals and then on some client-owned animals. But the drugs don't get real experimental use until they're used broadly on client animals. So that means they're being used in practice and we see what happens. And unfortunately, a lot of times when these drugs get that approval and then they're mass marketed, we find that, oh my gosh, there's a lot of side effects that we didn't know about. So this drug is still very early in the approval process. And so we'll get to that as we go through. And the drug I want to talk about is called Panoquell CA1. This is an injection that is being used in dogs that are experiencing acute pancreatitis. Let's talk more about Panoquell. So it's an injectable product that is meant to be used in animals that are being presented to the veterinarian for a pancreatitis episode. So vomiting, diarrhea, dehydration, abdominal pain. A couple things we need to know about this. This is a highly protein-bound drug. So that means when it's injected, it combines with proteins in the body. Use with caution with other medications is recommended if other medications are highly protein-bound. So what are some commonly protein-bound drugs that might be used at the same time as this drug? Well, a lot of these are things that are going to be given to pets with pancreatitis. Anti-inflammatory drugs, non-steroidal anti-inflammatories, antiemetics, so that's anti-vomiting drugs, which you've got a vomiting dog, what are you gonna do? You're gonna give it an injection of something for vomiting, and that is going to be a problem if given along with this drug. Antibiotics. Many veterinarians will give antibiotics to pets that present with pancreatitis. I don't think they're warranted most of the time, but they are often used. Diuretics. So if you have an animal who also has heart disease and they're on something like furosemide or torsemide, that's going to compete with this drug as well. And behavioral medications, and those are handed out like candy to our kids and our dogs at this point. Not really the way we should be going. It says drug compatibility should be monitored in patients requiring these other therapies. Well, all those things I just listed, many of them are going to be used at the same time as this drug if you have a dog with acute pancreatitis. So how is your veterinarian discerning what can and cannot be used together? Or are they discerning what can and cannot be used together? Concurrent medications used during the pilot effectiveness study included, but were not limited to, pain medications that were not NSAIDs, antiemetics, parasiticides, vaccinations, and medications to treat well-controlled pre-existing conditions. The safe use of Panoquell has not been evaluated in dogs with cardiac disease, hepatic failure, so liver failure or liver disease, or kidney disease. And a lot of these animals that present with pancreatitis may have 1, 2, or all 3 of those problems also going on. And the safe use of Panoquell has not been evaluated in dogs less than 6 months of age. A lot of precautions in here, a lot of times when you would not want to use this drug. Am I telling you you should never have this drug used on your dog? No. What I am telling you is maybe you need to educate yourself and make sure that your veterinarian is aware of all this. Remember, your veterinarian has to know thousands of drugs, thousands of diseases. Sometimes it all gets jumbled up or they haven't had time to really dive into what would interact with these drugs. So that's why it's so important for you to know and put this in the back of your mind. This is the information sheet on Panoquell where I'm reading all this information from. Anyone can download this. That's all we did. We went to the website for Panoquell and downloaded this information. So if you have a dog with pancreatitis and they're telling you, hey, we want to use this new injection, you might want to look this up on your little mini computer that you carry around with you. Then ask your veterinarian, well, is my dog also on any of these other things? Is my dog having any kidney trouble, liver trouble, heart trouble that would contraindicate the use of this drug? So let's look at the studies that were done with this drug. Panoquell has anti-inflammatory effects because it inhibits activation of something called LFA1, which inhibits inflammatory cell adhesion and migration into sites of tissue injury and inflammation. So what pancreatitis is basically an inflammation of the cells of the pancreas. And so this drug is going to inhibit that inflammatory process in that area. It's thought to limit pancreatic lesion expansion and help prevent complications such as multi-organ failure. And so with a dog with a really bad case of pancreatitis, they can go into shock. They can become really dehydrated. And when those things happen, that's when we get the secondary problems with kidney failure and liver failure. And we're trying to prevent that. So I get it. In theory, this sounds like a great idea. However, we've got all these interactions with other drugs, and we've got a few issues that were found. So now we're looking at the drug insert. Panoquell CA1 is conditionally approved pending a full demonstration of effectiveness. So this is a conditionally approved drug. It has not received full FDA approval. The effectiveness was demonstrated in a pilot field study. They took 61 dogs enrolled in the study. 36 were included in the effectiveness analysis. What happened to the rest of them? 61 dogs were put in the study, but 36 were included in the effectiveness analysis. So did the rest of them get pushed aside because they had other problems or because they had a poor response? Don't know. Let's see. Dogs were diagnosed with acute onset of pancreatitis based on clinical signs, clinical pathology results, and a CPL, which is a pancreatic lipase immunoreactivity test greater than 400, so that's a high number. Abdominal imaging consisting of ultrasound and or radiographs were evaluated to exclude cases of gastrointestinal obstruction, foreign body, and abdominal masses. Dogs with severe concurrent life-threatening illness other than acute pancreatitis were also excluded. Okay, now we know what happened to those other dogs. Of the 25 dogs excluded from the effectiveness analysis, most of the dogs began the study before the CPLI results were finalized and were later excluded because their CPLI results were less than 400. Okay. 6 were excluded for other reasons. Don't know. Of the 36 dogs included in the study, 17 received the drug and 19 just got a placebo, so just an injection of sterile water. All dogs enrolled in the study received the standard of care for acute onset of pancreatitis, including IV fluids, nutritional support, pain medications, but not non-steroidal pain meds, antiemetics, parasiticides, vaccinations, and medications used to treat well-controlled pre-existing conditions. Then they scored them on 7 clinical signs: activity, appetite, vomiting, abdominal pain, dehydration, stool consistency, and blood in the stool. It said dogs treated with the drug had a statistically significant reduction in those scores for those symptoms. Okay. Now we're going to talk about adverse reactions, things that the dogs showed that were given the medication. 31 dogs were administered the drug and 30 were just given a shot of sterile water. 16% of the dogs had anorexia, so loss of appetite. 16% had digestive tract disorders, including regurgitation, vomiting, flatulence, nausea, and enteritis. Respiratory tract disorders, 13% included pneumonia, inspiratory crackles, rapid breathing rate, and dyspnea, which is trouble breathing. Hepatopathy and jaundice, 13% of the dogs given the drug. Abnormal urine, 10%, included protein in the urine, blood in the urine, and malodorous urine. Some of the dogs were reported to have more than one abnormality. 10% had diarrhea, 6.5% had an arrhythmia, 6.5% had cardiac arrest, 6.5% had hyperthermia, which is a high body temperature, and 6.5% had hives and an allergic reaction. And these were higher than anything seen in the control groups. 4 of the 31 that were given the drug died during the study. It's kind of a high percentage, 4 out of 31. And 2 more had to be euthanized shortly after completion of the study. Of the 7 dogs that were euthanized during or after the study, 3 were attributed to complications from severe onset of pancreatitis, 2 of which were in the drug group. 1 dog in the drug group was suspected to have aspiration pneumonia and died after experiencing cardiac arrest. Suspected cardiac arrest. I don't know, makes me a little nervous. 2 deaths could be attributed to causes other than pancreatitis. 1 dog had intestinal lymphoma. But in a lab study of 32 healthy intact beagle dogs, so the study that we just talked about, those were client-owned dogs who had acute pancreatitis. So these were sick dogs that it was tested on. This is a study on healthy beagles. All dogs survived the study, but the administration of this drug resulted in hypertension, so high blood pressure, and injection site swelling and bruising. Hypertension with blood pressure greater than 160 was observed in the dogs with the Panoquell administration. Mild thrombocytopenia, so remember these are healthy dogs, so that's a low platelet count, was observed in 3 of the dogs. And then where the injection was given, there was hemorrhage or bleeding under the skin and an increase in severity in a dose-dependent manner. So that means this drug is causing that lowered platelet count and more bleeding. There was an increased evidence when they did biopsies of those areas of dermal fibroplasia, subcutaneous inflammation, and subcutaneous hemorrhage in the dogs that were administered the drug. All of that is in the drug handout, which again, you can look this up online as well. Pancreatitis is one of the problems that we hear about a lot, and it has a lot to do with how we feed our animals incorrectly. There are certain breeds that are prone to pancreatitis. For more information on the causes, symptoms, and treatment of pancreatitis, I would recommend looking at our pancreatitis course on Dr. Judy U that was made by Dr. Steve Marsden. He's just a genius. Great course. If you have a pet who has suffered with pancreatitis, it is definitely something you should watch. And also, Doctors Karin and Steve Marsden will both be speaking at the Naturally Healthy Pets Experience in Orlando in May 2025. They do have a company called Gold Standard Herbs with an herbal product called Adoptrex, which is very good for these animals that are prone to pancreatitis. We also have pancreatitis recipes to feed your dogs on our website, drjudymorgan.com, and also in the book, Keeping Your Pets Naturally Healthy. This is an early drug. It's got conditional use right now, and I think that over time we will see more responses and have a little more idea about the adverse reactions. The problem is making sure that this drug is not used along with the other medications that are highly protein bound that could cause issues for the pet, and also being really, really honest about what the pet died from and what it was caused by. Did they die because they had pancreatitis that they were going to die from no matter what we did? Or did they have a problem in relation to a new drug that is being tested right now? So ask questions. I know it's really hard to think about that when you're standing there with your sick dog and all you want to do is get them some treatment, and sometimes you're not even told what your dog is going to be given. They just get admitted to the hospital and then all kinds of things happen. I get that. The veterinarian has been trained to do what they're doing. They don't like to be questioned by a client who's standing there saying, well, what drugs are you going to use? What are the side effects of those drugs? But, you know, it doesn't hurt to have a knowledge base, ask questions, ask them in a nice way. Don't put anybody on the defense. Just say, can you give me a breakdown of what the treatment protocol is going to look like? And then also make sure that they're staying in touch with you multiple times a day if there is going to be a change in that treatment protocol versus what you were told at the beginning. So it's really all about staying on top of things, having a good line of communication. The nicer you are to the veterinarian and the staff, the easier it's going to be to have that open line of communication. Bring them gifts, be nice, but ask questions.